Everybody start taking their seats. One more, and then we start on this side.
Good morning, everyone. As president of Kane University, we identify wellness as a core value. It is my distinct pleasure to welcome you to our beautiful campus. Today, we are proud to join forces with Union County as the first university partner in the state of New Jersey for the ARRIVE program for mental health crisis response. Here at Kane, we strive to create a safe and supportive environment and recognize the need to revolutionize our strategies to bolster student mental health through a variety of programs. As an anchor institution in the state of New Jersey, Kane prides itself on leveraging human and intellectual resources to improve the long-term health and social welfare of our students in our community. I congratulate Union County and Chairman Sergio Granados on becoming the first county in the state of New Jersey to have 100% participation in ARRIVE Together from all of its municipalities. At this time, I am honored to introduce my good friend, New Jersey Attorney General Matthew Plackett. For those who don't know, Matt and I served on Governor Murphy's cabinet together a few years ago. His dedication to improve the lives of New Jersey residents is evident in all he does. Please join me in welcoming him to the microphone.
Good morning. Thank you, President Rep. Roulette. Still, I still have a hard time calling you anything but Lamont, so I'm sorry. We had a lot of fun. Some challenging times back then. We had a lot of fun working together, and when I look around these spaces you have, I know why you left Trenton. This is just beautiful. What a campus, and what a treat to be here. I'm so honored to be here with you and with this incredible group of law enforcement professionals, our mental health leaders, ARRIVE team members, people from my office, Commissioner. I really want to, at the front end, thank the county. What we're going to talk about here has been made possible in so many ways by state leadership, by Governor Murphy. I spoke to Senate President Scutari, who couldn't be here but is a huge supporter of this, and the county, and no county has been a greater supporter of this effort than Union County. And I'll talk more about what that means in real terms, but this does take a village to do this work, and that's why it's such an honor to have so many of you here. I'm joined today, of course, by our partner, Prosecutor Daniel, who has also been a tremendous leader in this effort essentially since ARRIVE began. Union County Commissioner Granados, the president and CEO for Rutgers University Behavioral Healthcare, Frank Ganassi. Thank you again. I feel like we're on tour, Frank. Linden Police Chief David Hart, ARRIVE team members, and Joyce Benz of the Intensive Family Support Services of Union County. Thank you all for being here today. Special thanks to all of our officers and our mental health providers. We could not do this work without you. It's easy for me to get up and talk about it, but you all have to go out and do it. I don't have to get in the car and respond when a call comes in. That's what you do. And I know how hard that work is, and I know how important it is. And as we'll talk about, it's saving lives. And so I'm grateful for all of you being here, and for the women and men who work with you, and Chief, there you are, for the women and men who work with you and with all of our law enforcement departments throughout this county and throughout the state. We're here at Kane both because I wanted to be with Lamont, but also because Kane, I'm really honored, is the first university in the state to combine its law enforcement and mental health resources to provide support through the ARRIVE program for its students. This is a real milestone in this program, which launched just a little under, believe it or not, 2 years ago. Here at Kane, on-campus officers will not only join their municipal counterparts in ensuring that ARRIVE is available to every resident in Union County, and I'll touch more on that in a second, but they'll use currently existing ARRIVE follow-up model the currently existing Arrive follow-up model to respond to calls for assistance on campus with resources that are specific to Kane's population. And we know, and I was just talking to the president about this, we know that there are specific challenges on college campuses, and we know that particularly our youth and our younger residents are dealing with a mental health crisis in this country, and that doesn't go away when they leave home and go to campus. In some ways, it becomes even more challenging. That's particularly true, I think, in an era of social media where we as a state are leading efforts to hold the social media companies accountable, but the effects are felt on the ground. And so the partnership we have with Kane is, I think, an incredibly important one as we begin to expand Arrive statewide. Kane's home to a particularly diverse population, 16,000 undergraduates, 2,000 graduates living here on these residence halls and attending school here. And again, they face unique challenges relative to the student population. This involves everything from leaving home to academic demands, peer pressure, as I mentioned, social media. And we want them to experience that college life and graduate student life to the fullest extent possible. But when they're struggling, we know, like so many others, they turn to 911 and they turn to law enforcement. And so now we're equipped to respond to those calls through the Arrive program in a way that is enlightened and that actually meets their needs. And thanks, I should say, to the law enforcement agencies in this room, I'm also pleased to announce that Union County, all 570,000 residents of this county, as well as the college students who live here, will now have access to Arrive in one form or another. All 25 law enforcement agencies in this county are now participating in Arrive. That includes the law enforcement agencies from all 21 municipalities, as well as the Union County Prosecutor's Office, the Union County Police, the Union County Sheriff's Department, and again, the Kane University Police Department. I want to give my sincere thanks to the leaders of Berkeley Heights, Clark, Cranford, Elizabeth, Fanwood, Garwood, Hillside, Kenilworth, Linden, Mountainside, New Providence, Plainfield, Rahway, Roselle Park, Scotch Plains, Springfield, Summit, Union, Westfield, Winfield, and the County of Union for embracing this program. I wanted to specifically read all of those because, again, you have to see how much support it takes to expand this program. When we say we're going to expand this program statewide, it takes municipal, county, and state leadership to do so, as well as our law enforcement and our mental health provider partnership. And we're getting that here in Union County, and I'm tremendously grateful for it. Arrive stands for Alternative Responses to Reduce Instances of Violence and Escalation. I had to read that because I'll be honest with you, I say it all the time and I always forget it. But really what Arrive is, it's a recognition that we've asked law enforcement to do too much. We've asked law enforcement in this country and in this state to be more than just patrol officers. We've asked them to be mental health providers and social workers, psychologists, behavioral health counselors, addiction specialists, family dispute mediators, on and on. And no one person, if we're being honest, can do all of those things. And so Arrive says that we're going to provide law enforcement, the best trained, by the way, law enforcement officers in the country. No state in the country has all of its law enforcement officers trained in bystander intervention and de-escalation the way we do. All of our Arrive officers are trained in crisis intervention team training, a 40-hour intensive training that they go through with medical providers. And we're going to provide them the resources to respond to these calls, the calls involving mental health or emotional distress, which are the calls, and you all know this, that are most likely to result in a bad outcome, whether that be a use of force, an injury to an officer or a civilian, a mental health crisis, or something that gets at that fundamental trust between law enforcement and the community in a way that breaks that trust as opposed to help build it up. So we started Arrive 2 years ago with a pretty simple model. It started in Cumberland County, a good ways away from here, with state police and the Cumberland County Prosecutor's Office, as well as mental health providers, responding to calls of mental health or emotional distress in an unmarked car with a plainclothes officer and a mental health screener. They arrived together. That's why I can't remember what it means because the pun makes sense. They arrived together and they responded to instances of crisis. We thought it was important to expand this program and prove that it could work in Cumberland, but can it work in a dense urban environment with a municipal police department? So we came here. We came to Linden and Elizabeth, and I want to thank Chief Hart and Chief Sacca, and it worked. It worked just as well in a municipal department with the unique challenges of our denser environments as it did in Cumberland. And now we're expanding it statewide. Today we're in 13 counties. We're serving about 25% of the state's population. Again, we're serving all 570,000 residents as of today in Union County. And by the end of the year, we're going to be active in all 21 counties. And that is going to make New Jersey the first state in the country to have an alternative response model in every county in our state. And it's important to note that as we've expanded, just as we've done here in Union, before we've gone into a community, we've partnered with the community. We've asked them, what is it that your concerns are, what are your needs, and we've assessed the resources available. And we will continue to do that as we expand statewide, because what works in Linden may not work in Scotch Plains, and what works in Scotch Plains may not work in Atlantic City or Salem City or Gloucester or Camden or the very diverse parts of the state. And this is obviously a very diverse county. And so the fact that we're able to do this work in all 21 municipalities here in Union County, serving over 500,000 people, tells you the potential that this program has to change lives. The models will look somewhat different. Some will have the co-responder model that we've had originally. Some will have a follow-up model where police will identify individuals who they've come in contact with, and mental health providers will provide follow-up services. Some will have, as we're going to be doing soon in Union County, dispatched mental health only response to calls that we know can be handled safely without a law enforcement response. In other parts of the state, we're experimenting with telehealth. But the core is that we're going to be providing alternative response to moments of crisis, getting people the help that they need, the mental health care that they need, and ultimately the support that they need while keeping everybody safe, keeping that resident safe, keeping our officers safe, and helping build community trust. And I'll finish with this. The best thing I can say is that it's working. We've served over 420 people. I believe the number is 427 by last count here in Union County alone. We've served over 1,400 people statewide through ARRIVE program. And that number, as you'd expect, as new programs have come online over the last couple months, is starting to look like a hockey stick. It's going up significantly. And the best thing about that number is I get a report every week, and each week that number is going up, but there's a few numbers that have not changed. We've helped over 1,400 people. We've had no injuries to officers, no injuries to residents, no arrests, no uses of force, except for a few instances where officers had to use force in connection with transporting someone to mental health treatment at the direction of a clinician. And ultimately, trust has been built. And so you think about that. It's hard to know what any one of those 1,400 calls would have looked like without an ARRIVE response. But every single officer here, I'm sure, and every single mental health provider knows how challenging those calls are. And we know, because we look at the data, and we've also lived through this, we know that those are the calls that are most likely to result in those bad outcomes that I talked about. And the fact that we're not seeing them is, to me, proof that what we're doing is working and changing lives. And so I am truly grateful for everybody's partnership in this effort. I'm more excited about this work probably than anything else I've done in my life, because it is the work that is truly going to change how law enforcement functions, not just in New Jersey. People are looking at us across the country, and because Union County has embraced this in such a deep and with a sense of deep commitment, people across the country are looking at Union County, because if it can work in counties like Union with the diversity of this population, maybe the most diverse county in the country, in terms of the population that lives here and the needs of this community, then I think it can work anywhere. And so I'm really thrilled to see this progress, and grateful for all of you for being a part of it, and grateful for what the officers and mental health providers do each and every day to keep us safe. So thank you, and I'll now turn the podium over to my partner, Prosecutor William Daniel.
General, if it's okay with you, I'm just going to reread what you said. Actually, in all seriousness, a warm, let me just give you this. Thank you. Thank you very much, sir. A warm Union County welcome to each and every one of you present here today. President Repollet, sir, thank you very much for hosting this event today, and thank you for being a great partner to law enforcement and the Union County community. Attorney General Platkin, thank you for your leadership. If this program was inspired by Attorney General Platkin, it was through his leadership and foresight that we're standing here today having completed a portion of the task ahead of us, a major portion. And I just want to thank you for including Union County in the pilot program. I think it was back in June of 2022 when you and Chief Hart and Chief Sock and others stood at the John Stamler Academy and announced the unfolding of that pilot program. And here we are today, all 25 law enforcement agencies in Union County. We have our mental health providers, Trinitas Hospital, thank you very much. Rutgers Behavioral Health, thank you. County commissioners, thank you very much. Chairman Granados, since day one, when I took office back in July of 2021, has been involved in untold mental health programs here in Union County. And the county commissioners, all of them, have supported every initiative that has been brought forward, not only through our office, but through the community, through the Attorney General's office. An example of that being the Safe Place Initiative, which is countywide. We're proud of that, and we're very, very proud of where we stand here today with Arrive. This really comes down to a team effort. That's what it's all about, teamwork. County Manager Ed Oatman, thank you, sir. Thank you very much for everything you do for us and our team. Our team, all right? Look, we're all on the same team here. It's like, I was thinking about this today. Like, if you talk about baseball, there's like 20-some-odd teams in the league, okay? And they all together make one team, whatever sport you want to talk about. Here we have 5 or 6 separate teams. We have the state-level team, we have the county team, we have the local municipality team, we have the mental health team, and probably the most important team member who's not here today but is hopefully watching this, and we'll see this rolled out, is the community, the residents of our county that, comprise the bulk of our lineup, so to speak. And we're servicing them in a truly public service-minded way, and it's highly effective. And, as my mother used to say, the proof's in the pudding, and I know Attorney General Platkin rolled out stats. These are the correct, up-to-date stats. It's just remarkable what we've done here. I want to just reiterate thanks again, especially to the law enforcement agencies here in Union County. It was easy to roll this program out. The General, floated the idea to our office, we jumped on board, and then we decided to expand it. And yes, and to compete with Middlesex a little bit, okay? I have to call Prosecutor Chacon this morning, and, we'll have a great conversation. And it's all in the interest of public service, and it's actually fun to do this. So these law enforcement agencies, you, the members of law enforcement, whether you're the chief or whether you're the Arrive Together liaison from your department, thank you very much for jumping on board. It was a pleasure meeting with each and every one of you to talk about this, and then you jumped on it, and thank your governing bodies as well for their support. To the mental health providers, Dana, thank you very much for everything you do. You and your team, sir, thank you. It's all about providing better service to the public, service that these recipients of the service deserve as our citizens. And I'll end it with this. I've had the opportunity to sit in on the monthly meetings of Arrive Together and just listen. And the members of the Arrive team, law enforcement, mental health providers, they share their stories. What happened over in Westfield this week? What happened in Plainfield? Anybody want to share a story? And I've heard countless stories of not only the appropriate response being provided and the appropriate referrals and the appropriate follow-up aftercare that comes with this, but also the response from the community. Community members have contacted our law enforcement agencies to thank them for the nature, the form of the response, and actually within the last couple of weeks I heard a story, it's not a story, it's a factual accounting of what occurred in one of our towns where the residents came out and actually cheered the co-responder team that was out there. So this is the way, this is the wave of the future, and we have a long way to go to fine-tune it, but we are certainly on sound footing. a sound playing field. So thank you for everything. Thank you for the opportunity to stand here in front of you today. Thank you.
Thank you. By the way, Ed, I didn't see you hiding out back there, so let me thank you as well. And again, reiterate my support for the county, and also I mentioned them, but Senate President Scutari, and I thanked him for this yesterday. The legislature and Governor Murphy authorized $10 million to support this statewide expansion, and the Senate President and I talked about this yesterday. That's the best $10 million that the state's ever going to spend, because I'm telling you, we're going to make back. On top of all the benefits, this is going to save untold amounts of money. It's going to save healthcare bills because people aren't just getting dropped off at the ER and told figure it out. It's going to save police overtime because officers aren't waiting for the mental health provider to show up. And it's going to save costs on the back end when we're not dealing with those bad outcomes. And I know that's not why we do this, but I think it's important to say when we make investments like this that these are really good use of taxpayer dollars, and we couldn't have done it without again, every level of government. And I also have to thank the county, and I have to thank the prosecutor. I wanted to make sure he was going to say nice things before I reminded him that imitation is the greatest form of flattery, because we stole the person who was leading the Union County effort for him, and Tiffany Wilson, who now runs our Office of Alternative and Community Response, to coordinate this work on a statewide basis. She and Senior Counsel Derek Daly have been doing tremendous work. So I'm glad I can still come back to Union, Bill. But thank you again to everybody. I want to now invite to the podium Frank Ganassi, who's the Senior Vice President for Behavioral Health at RWJ Barnabas, and again, just a tremendous partner, and also President and CEO of RUBHC. Did I get that acronym right? Yeah. Or HBC. I'm sorry. I struggle with the acronyms. But I know that Frank has just been a tremendous partner to us in this effort and has been a supporter of ARRIVE. Don't hold this against him, but not in Union and throughout the state. So grateful to have you here, Frank.
Well, thank you, Mr. Attorney General, and I appreciate the opportunity to say a few words this morning. So I think the attitude for this morning, I think you've heard this, is really gratitude for the work that's been done across the state. I want to thank Tracy Wilson for all of her tireless efforts on this. I see in the room Joe Kafari and Dana Malici, obviously a lead. Lisa Dressner from RWJ Barnabas Trinitas couldn't be here today. And obviously we're representing Rutgers University Behavioral Health Care as well. This is groundbreaking work. For those of us who've been in the field for as long as I have, what you realize is, if you look around this room, and this is a sobering fact, the odds are that 1 in 5 of the individuals in this room in your lifetime will experience a mental health crisis. You will experience a depressive episode. You will experience bouts of anxiety. You will experience substance abuse. It is inescapable. It's unfortunately one of the birthrights, and it is something that has been only worsened by events over the last 4 or 5 years that have included a once-in-a-100-year pandemic, economic strife, and a lot of social unrest in the country as well. There's never been a time when mental health is not more at the peak, and I believe that the partnership that the Attorney General and the Governor, Tracy, and the others in the room have helped put together has made that moment of crisis, that inflection point, one that can be a new beginning. I think for many people, you're familiar with potentially the crisis that happens when somebody in your family suffers a stroke or a heart attack, and help is called. And there's a feeling of helplessness. And I think one of the things I want to hopefully you leave with here is the belief, as I hold, that mental health crises are no different than medical crises. They are a medical crisis. And I think that for generations we've separated mind and body in a way that creates this belief that somehow what happens from here up is different than what happens from here down. Behavioral health disorders are as genetically inherited and are as biochemical as diabetes or any other care, and crises in those disorders is as real as crises in a heart attack. And I think that this program humanizes that. Attorney General has pointed out that very often officers have been cast in multiple roles. And I think that this offers the opportunity for mental health specialists, screeners like we have in the room, to be partners in real time and in the moment with law enforcement officials who can make a difference in people's lives. I believe in recovery. I believe in the power of treatment, and I believe in the power of intervention. You know, out of crisis comes change. We often respond to things because we have no other choice but to. And so I am enormously impressed with what's happened in Union County. I can't be more proud. You know, I sit on a couple of national committees, and one of the things we frequently brag about is that we're going to be one of the first states in the country to have this kind of Arrive programming in the entire state. And that really sets apart the state and the organization. It's something that Union County deserves to be proud of. We're certainly thrilled at RWJ Barnabas Health and RWJ Barnabas Trinitas and Rutgers UBHC. We're thrilled to be a part of it. We look forward to continuing to contribute. And I want to end on just reminding us all why we do this. When I was very young and starting out in the field, I was in the state of Pennsylvania, where I worked, by the way, very closely with the Pittsburgh Police Department early in my career. I was in addictions in those days. And the then commissioner of mental health was a guy named Charlie Curry. I don't know if anybody remembers him. He ended up serving in D.C., I believe, on the Homeland Commission for a short time. And I was at a meeting when I was probably in my early 20s, and I never forgot this. And he was asked, much like you will hear with other questions, what is it people with mental health want? Almost in a kind of an annoyed way. And his answer was something I never forgot. And when you're in the moment of crisis and you're intervening with somebody who is in the middle of that crisis and who may look like they are not necessarily in control and the family's frightened, what I want you to remember is his answer, which was, they want the same thing you want. They want a safe place to live, they want meaningful activity, and they want a date on the weekend. And I think that a big part of what we're trying to do is to return people to that normal life. Arrive Together is going to be a key part of that, and we're very grateful for everybody's role in that. So thank you very much.
Thank you, Frank. So well said. And maybe Arrive will get into the dating services as well. I want to invite Chief Hart to the podium. And as I said, Linden was one of the first 2 municipal departments in the state to do Arrive. And that was back when Arrive was very much an unproven concept in New Jersey. People who joined the program still to this day, but especially then, did it because they wanted to, not because they had to. And they were willing to prove that we could do something different that would work. And I'm just tremendously grateful for that partnership and that you'd be here today.
Good morning, everyone. Before I open my very brief remarks, I just want to say thank you for the invite here today at Kane. This is my alma mater for my undergraduate degree. Thank you, and hello to all my friends here in the audience. I see a lot of familiar friends in policing and clinicians and other partners here in government. And I just want to say I've been a police officer over 30 years, and I was in EMS, for those who know me a long time, over almost 40 years in EMS. I retired actually 3 years ago. And this is the worst mental health crisis I've ever seen in our state and in our country. So on behalf of President Chief Sacco, who is the Elizabeth Chief and President of the Union County Chiefs Association, I'd like to thank Attorney General Platkin, Union County Prosecutor Daniel, all those on the dais here, for facilitating the expansion of the Arrive program here in Union County. The Union County Chiefs are happy and proud to be the first county in the state of New Jersey to have 100% participation in this tremendous program. I'm also proud to say, as the General has mentioned, that Linden and Elizabeth were the first municipal police departments in the state of New Jersey following the state police to participate in the Arrive program. We were the pilot municipal departments here in New Jersey. Today's Union County participation, as you've been informed, of 25 police agencies will allow us to reach every community's most vulnerable citizens in crisis. It will allow for timely follow-ups by one of these 3 teams throughout the county. This is a tremendous example of community policing and community outreach, and which is a true partnership for all those involved. It's a true collaboration. The Union County Chiefs Association would also like to thank Trinitas Hospital, our good friends over there, the clinicians, of course, Rutgers Health, and all their dedicated clinicians for being on the forefront of this initiative. Also like to thank all the Union County chiefs and directors who are here and not here, elected officials in the municipalities for allowing this program to continue and for their vision for this expansion. Also want to do a shout out to my Linden officers, Jordan, Dumais, and Stewart, who are here, and again, all those in law enforcement, all my friends, chiefs, officers, and directors here in the room. Again, thank you, Attorney General Platkin, Prosecutor Daniel, and all those here. This is a tremendous announcement. Job well done. Thank you.
Thank you so much, Chief. When I took office a little under 2 years ago, I said that I wanted to expand this program statewide, and I was asked, how are you going to pay for it? I said, we'll figure that out. And then not too long after we expanded in Linden and Elizabeth, somebody on our team said, hey, I think Union County's like voluntarily putting some money into this. And I said, I've never seen that before. I've never seen a county or any government agency put money into something without us having to ask for it. And it's because they really believed in the work, and they've been just tremendous partners. And so, Chairman, I invite you to the podium and just thank you so much for the support. We wouldn't be able to do this work without you.
So as I got ready this morning, I knew I forgot something. And as I was standing up here along these individuals, I realized I forgot to wear a tie. So I apologize for that in advance. That's one thing I wasn't wearing today. But today is truly a great day here in Union County. You know, with the expansion of the Ride Together program, we know that it's going to be beneficial to our local communities. We know that King University, we thank you, Dr. Repollet, also as a former graduate of King University, for letting us be here today because it symbolizes the diversity Union County is. Stepping Up to Mental Health is an initiative that has been at the forefront of my 2023 Chairman's Building a Stronger Union County theme, and the Ride Together program goes hand in hand with these initiatives. Since late spring, we have worked closely with key partners, including my fellow colleagues on the Board of County Commissioners, County Manager Ed Oatman, Deputy County Manager Amy Wagner, our Union County Police Department, our Union County Prosecutor's Office, headed up by Bill Daniel, and also Tiffany Wilson, who's been strongly instrumental in making sure this happened. Our Union County Police Department, our Union County Police Chief Mogensen, our Public Safety Director also, Dennis Burke, the Sheriff's Department, and most importantly, Attorney General Matthew Platkin and his office to help make sure that we explored opportunities in the expansion of this highly successful Arrive Together program here, working alongside Trinitas Regional Medical Center. As you all know, this life-changing program aims to enhance our community mental health response, and the remarkable results of this pilot program left no doubt in the mind that we needed to contribute funding from the county, as Attorney General just stated. That is why we worked closely with our Department of Economic Development to secure CDBG funding and allocate money to successfully expand this program to include all 21 municipalities in the County of Union. Additionally, I'm immensely proud, not only as a graduate, but as someone from Union County, to have worked alongside with our key partners, with President Dr. Repollet, to make King University the first educational institution in the state of New Jersey to adopt this program. I am excited to witness this initiative come to fruition countywide, and I look forward to its continued success. I extend my sincere gratitude to all the partners, including our local municipal agencies, police departments, everyone who's stepped forward in making sure that, there was 24/7 phone calls, emails, text messages, not only now, but these past year or so, in making sure that this was able to work together, because as the prosecutor said before, this is a team effort. And as the Attorney General stated, only working together can we continue to move our county and state forward in the right direction. So once again, I thank each one of you for being here today. I thank everyone who's part of the team in making sure this happened. And this truly will be life-changing to so many individuals. So thank you.
Thank you so much for those remarks, and again for the commitment of the county as we work to make this program a model for the rest of the state and the country. Last but certainly not least, we talk about the partnership between law enforcement and mental health, and I've had the privilege of seeing that partnership in real time, talking to our mental health screeners or talking to our law enforcement officers who are out there, and to a person, each one of them says, if before Arrive, these are not conversations we would have had. We didn't even really speak the same language. And now they're not just speaking the same language, but responding in the same vehicle in many cases. and ultimately producing far better outcomes than I think anybody would have thought possible. And that's a testament to everyone, especially our mental health partners in this effort. And I want to welcome Joyce Benz, who's the program director for the Intensive Family Support Services of Union County, who's been just such an instrumental player in making this a success. So thank you so much for being here.
I'm Joyce Benz, a social worker at the Mental Health Association in New Jersey, and I work on a daily basis with individuals and families dealing with serious and persistent mental illness in Union County. The families who utilize our support services are thrilled to learn about the expansion of Arrive Together in all 21 municipalities in Union County. Several have already utilized the program and have found it to be more proactive and less stigmatizing option, a new tool in the toolbox for families and individuals to get the help they need to prevent the escalation of a mental health crisis. It's an opportunity for the mental health community and law enforcement to work in a collaborative manner, utilizing their unique skill sets to reach out to individuals in the community before their mental health symptoms escalate to the point of dangerous to self or others. The Mental Health Association supports the Arrive initiative as an important addition to crisis services, and we believe it's crucial for both police and community providers to continue to be certified in crisis intervention training in order to participate effectively in the program. It's not a coincidence that Union County has been chosen as the county to expand this initiative. Since 2007, following the untimely death during an interaction with police of a young man experiencing a mental health crisis, his family, the Union County Prosecutor's Office, law enforcement, and the mental health community, including NAMI and the Mental Health Association, have worked collaboratively through CIT and other initiatives to promote de-escalation techniques, decrease stigma, and open avenues for those dealing with mental illness to safely get the help they need. Arrive Together, along with the continued CIT training and the National 988 number, are all vital new additions. Here are some comments from families who have already utilized the Arrive program. And these are quotes. The response time was much faster. The screener was experienced. The officer was CIT trained and was great, not dressed in a uniform, and was nice to talk to. They didn't rush us at all. He also gave us contact information if we needed to reach him. They came without a marked car, and just one screener and one officer calmly spent sufficient time with us and offered to come back in the future. My family member was more comfortable talking with them, and it wasn't as scary or embarrassing as it has been in the past with a lot of police cars showing up at the house. Thank you.
I think that says it all. And so, again, I'll just finish where I started by thanking everybody for being a part of this program, being here today, but most importantly for the work that we're doing. And just please know that we're here to support it, and I'm just so grateful for what you do each and every day. So thank you. I think we want to do, Sharon, a picture.
Photos.
Yeah.
We're going to do a couple photos in the back, so if we could, we'll get everybody assembled in the back. We might do some with law enforcement and then some with our mental health providers. So we'll just meet everybody in the back of the room.
Okay. Thank you.
Thank you.
Before you go, I want to make sure we get Thank you for everything. Thank you. Great job as always. Thank you. Thank you. No, I could do it. I could do it. But I'm doing this. I weren't prepared.
Joyce, wonderful reminder.
Thank you.
Thank you so much for being here.
Thank you, sir. Are you staying around?
You did it. You did fall. You did wonderful things. I love it.